Introduction. Welcome students to today's lecture on Fragile X syndrome, FXS, a neurodevelopmental disorder that affects millions of people worldwide. As future medical professionals, it is crucial for you to acquire a comprehensive understanding of the molecular mechanisms, clinical consequences, and potential therapeutic strategies related to FXS. Throughout this lecture, we will delve into various aspects of the disorder, ranging from the genetic basis to diagnostic and treatment approaches. So, let us begin our exploration by discussing the molecular mechanisms and clinical consequences of FMR1 gene expansion. Fragile X syndrome is caused by the expansion of a repeat sequence within the FMR1 gene on the X chromosome. This gene produces a protein, FMRP, which is important for brain development and function. In healthy individuals, the repeat sequence contains 6 to 50 CGG repeats, but in those with Fragile X syndrome, the repeat number exceeds 200, resulting in the gene being turned off. This expansion leads to a range of clinical features, including cognitive impairment, social difficulties, hyperactivity, and characteristic physical traits. Understanding these molecular mechanisms and consequences is crucial for diagnosing and treating Fragile X syndrome effectively. In females, Fragile X syndrome, FXS, is influenced by X inactivation, where one of the two X chromosomes is randomly inactivated in each cell. This process ensures gene dosage equality between males and females but results in a mosaic pattern of gene expression. However, the FMR1 gene on the active X chromosome is important for normal FMRP production. In females with one normal FMR1 allele and one mutated allele, sufficient FMRP can still be produced to mitigate the effects of the mutation. However, X inactivation can vary between tissues and influence the severity of FXS manifestations, making it important for diagnosis and prediction. The neurodevelopmental aspects of Fragile X syndrome, FXS, are foundational to understanding the disorder. FMRP, a protein necessary for brain development, is deficient in individuals with FXS, leading to abnormal synaptic plasticity, dendrite growth, and neurotransmitter signaling. These abnormalities in early brain development manifest as cognitive impairments, learning disabilities, and executive functioning deficits. Further research has indicated that neurogenesis, neuroplasticity, and neural connectivity are also disrupted in FXS. Key signaling pathways involving mGluR5, GABA, and BDNF are implicated. Understanding these neurodevelopmental aspects can guide interventions to improve cognitive function and overall outcomes for FXS patients. In addition to cognitive impairments, individuals with FXS often experience a range of neuropsychiatric comorbidities that significantly impact their overall quality of life. Anxiety disorders, including social anxiety and generalized anxiety, are highly prevalent in this population, affecting up to 90% of individuals. Similarly, mood disorders, such as major depressive disorder and bipolar disorder, are more common in individuals with FXS compared to the general population. Attention deficit hyperactivity disorder, ADHD, is another commonly observed comorbidity in FXS, affecting approximately 2/3 of individuals. Symptoms of ADHD, including impulsivity, inattention, and hyperactivity, further exacerbate the academic and behavioral challenges faced by individuals with FXS. Additionally, individuals with FXS often display features of autism spectrum disorder, ASD, although the prevalence varies among individuals. It is important to recognize and address these neuropsychiatric comorbidities in clinical practice, as they significantly impact patient management and treatment outcomes. The pathophysiology of FXS involves abnormal synaptic plasticity and dendritic spine morphology, which contribute to the cognitive and behavioral characteristics of the disorder. Dendritic spines are tiny protrusions on the surface of neurons that play a crucial role in synaptic transmission and plasticity. In FXS, these spines exhibit abnormal morphology, including increased length, branch number, and reduced spine density. Furthermore, dysregulation of synaptic protein synthesis and impaired local protein translation contribute to the synaptic abnormalities observed in FXS. FMRP, the protein encoded by the FMR1 gene, regulates the translation of numerous synaptic proteins, including those involved in synaptic plasticity and dendritic spine formation. Loss of FMRP function disrupts the delicate balance of excitatory and inhibitory synaptic signaling pathways, leading to the characteristic neurophysiological and behavioral abnormalities seen in FXS. Understanding the aberrations in synaptic plasticity and dendritic spine morphology is vital for developing targeted therapeutic interventions aimed at restoring normal synaptic function in individuals with FXS. FMRP, the protein produced by the FMR1 gene, plays a pivotal role in normal neuronal development and function. This RNA-binding protein is involved in regulating the translation of messenger RNA, mRNA, at synapses, thereby exerting control over protein synthesis. FMRP achieves this regulation by binding to specific mRNAs, effectively preventing their translation into proteins or modulating their synaptic localization. The absence or deficiency of FMRP disrupts the balance of synaptic protein synthesis, leading to impaired synaptic plasticity, neuronal connectivity, and dendritic spine morphology. Recent studies have highlighted the role of FMRP in modulating the activity-dependent regulation of protein synthesis in response to synaptic stimulation. Understanding the role of FMRP in neuronal development and function is crucial for identifying potential therapeutic targets and strategies aimed at restoring normal neuronal activity in individuals affected by FXS. Despite ongoing efforts, there is currently no cure for Fragile X syndrome. However, advances in our understanding of the molecular mechanisms and pathophysiology of FXS have identified potential therapeutic targets and strategies. One such molecular target is the metabotropic glutamate receptor 5, mGluR5. Animal studies have demonstrated that pharmacological modulation of mGluR5 activity can rescue various phenotypic characteristics associated with FXS. Several clinical trials have been conducted or are ongoing to evaluate the efficacy and safety of mGluR5 antagonists in individuals with FXS. Other potential targets include the GABAergic system, the endocannabinoid system, and the BDNF-TRKB signaling pathway. Modulation of these systems has shown promise in preclinical studies, warranting further investigation for potential therapeutic avenues. Moreover, comprehensive management of individuals with FXS requires a multidisciplinary approach, involving various professionals such as neurologists, psychiatrists, speech therapists, and occupational therapists. Behavior and educational interventions, together with pharmaceutical interventions targeting specific symptoms, may be beneficial in managing the diverse clinical manifestations associated with FXS. Neuroimaging techniques, including structural and functional magnetic resonance imaging, MRI, provide valuable insights into the structural and functional abnormalities associated with FXS. Structural MRI studies have consistently demonstrated alterations in brain anatomy among individuals with FXS. These abnormalities often involve the prefrontal cortex, hippocampus, amygdala, and cerebellum. The alterations in the prefrontal cortex, a region essential for executive functioning and attention, correlate with the cognitive deficits observed in affected individuals. Functional MRI studies have revealed aberrant patterns of brain activity and connectivity in several brain regions, including those involved in social cognition, language processing, and sensory-motor integration. Abnormal functional connectivity, characterized by both hypoconnectivity and hyperconnectivity, has been observed between different brain regions in individuals with FXS. Neuroimaging findings play a crucial role in enhancing our understanding of the neural underpinnings of FXS, aiding in the identification of potential biomarkers and guiding treatment strategies. The FMR1 gene mutation in FXS exerts a profound impact on various neurotransmitter systems, contributing to the wide spectrum of clinical manifestations associated with the disorder. One of the prominent alterations observed in FXS involves the glutamatergic system. Dysregulation of metabotropic glutamate receptor signaling, specifically mGluR5, leads to abnormal synaptic plasticity, impaired long-term potentiation, and altered dendritic spine morphology. Additionally, gamma-aminobutyric acid, GABA, signaling, the primary inhibitory neurotransmitter in the brain, is also disrupted in FXS. Altered GABAergic transmission, coupled with imbalances in excitatory/inhibitory signaling, contributes to the cognitive deficits, sensory processing issues, and hyperactivity exhibited by individuals with FXS. Furthermore, the endocannabinoid system, which plays a crucial role in synaptic plasticity and memory formation, is dysregulated in FXS. Abnormalities in the endocannabinoid system have been implicated in the cognitive deficits and behavioral abnormalities observed in individuals with the disorder. Understanding the impact of FMR1 gene mutation on neurotransmitter systems provides valuable insights into potential targets for therapeutic intervention. Epilepsy is a significant comorbidity in individuals with Fragile X syndrome, with prevalence rates ranging from 10% to 20%. Compared to the general population, individuals with FXS have a higher risk of developing epilepsy throughout their lifespan. The most common seizure types observed in FXS include generalized tonic-clonic seizures, absence seizures, and focal seizures. The presence of epilepsy further complicates the management of individuals with FXS, as it adds to the cognitive and behavioral difficulties already faced by patients. The underlying mechanisms linking FXS and epilepsy are multifactorial and not yet fully understood. Aberrations in synaptic plasticity, dendritic spine morphology, and neurotransmitter systems likely contribute to the increased susceptibility to seizures observed in this population. Genetic counseling and reproductive options play a vital role in supporting families affected by Fragile X syndrome. Genetic counselors provide information regarding the inheritance pattern, recurrence risks, and available reproductive options to affected individuals and their families. Carrier testing is an important aspect of genetic counseling for FXS, allowing individuals to determine their carrier status for FMR1 gene mutations. This knowledge is crucial for making informed decisions regarding family planning, reproductive options, and prenatal testing. In addition to genetic counseling, various reproductive options are available to families affected by FXS who wish to conceive. These options include pre-implantation genetic diagnosis, PGD, prenatal screening, and prenatal diagnosis. PGD involves the screening of embryos created via in vitro fertilization, IVF, for the presence of FMR1 gene mutations before implantation. The integration of genetic counseling and reproductive options empowers families affected by FXS, enabling them to make informed decisions regarding their reproductive choices. Animal models have played a crucial role in advancing our understanding of the pathophysiology, identifying potential therapeutic targets, and assessing treatment strategies for FXS. Various animal models, including mice, fruit flies, Drosophila, and zebrafish, have been developed to mimic the genetic and phenotypic characteristics observed in individuals with FXS. Animal models allow researchers to investigate the underlying molecular mechanisms, study the effects of targeted interventions, and assess treatment efficacy in a controlled setting. Through animal models, researchers have uncovered valuable insights into the role of FMRP in neuronal development and function, aberrations in synaptic plasticity, and potential therapeutic targets. Animal studies have also aided in the development and evaluation of potential therapeutics, including pharmaceutical interventions, gene therapies, and targeted molecular therapies. Animal models continue to provide a valuable platform for understanding the complex mechanisms underlying FXS, facilitating the translation of preclinical research to potential clinical interventions. Fragile X syndrome is a complex neurodevelopmental disorder with various aspects that impact individuals and their families. Our exploration of this syndrome has covered molecular mechanisms, clinical consequences, neurodevelopmental aspects, synaptic aberrations, and neuropsychiatric comorbidities. Understanding FXS is crucial for improving diagnostics, therapies, and support for affected families. As future medical professionals, your comprehension and commitment to ongoing research are essential in enhancing the lives of those with FXS. Let us continue our exploration, research, and awareness efforts towards breakthroughs that can alleviate challenges and bring us closer to a brighter future.